Hi, my name is Dr. Igor Tabrizian. I'm a qualified medical doctor with a background in integrative and preventative health. On this channel, I'll explore evidence informed approaches to optimize well being from nutrition, gut health to hormones, energy, and everything in between. Please note, this information I share is general in nature and not intended to be used as medical advice. Always consult your own healthcare professional before making any changes to your health routine. I want to start the nutrient stream with something that seems to be quite topical at the moment, and that is the problem with vitamin B6. There's two ways to figure out what something does in the body. One is to define its job. So, vitamin B6 is important for making hemoglobin, for instance. Or you can define it as what happens when it's missing. And between those two ways or methods, you find symptoms of B6 deficiency. So you might have skin issues, mood changes, neurological symptoms, anemia, impaired immune system, fatigue, cognitive issues, hormonal imbalances, and cardiovascular problems. It's a pretty wide list. That's basically every chapter in a medical textbook. So where does B6 come from? Well, we get some in our diet, some in our supplements, and some from our gut bacteria. And when you add all these up, you can get the total intake. Now, the recommended amounts are between 1.3 and 2 milligrams a day. And it's reasonably easy to get to those levels just with a diet if you know what you're doing. But when we're talking about toxicity, we're saying we're linking symptoms that somebody has to a level in the blood. Now, the problem with that is the biochemistry of the body doesn't occur in the blood. It occurs in the cells. So when you take a sample of somebody's blood, it's like looking in a courier's van and saying, oh, what have they got in the van? It doesn't tell you anything about the houses or factories they're about to deliver to. So it's very misleading to take levels of something in the blood and make assumptions unless you know all of the contributors to what happens. And I think by the end of this, you'll realize that there's been some errors of judgment with these assumptions. So the daily sources of B6, you've got poultry, beef, liver, salmon, fish, these sort of carnivore type things. And then you've got things like avocados and bananas, chickpeas. We'll come back to some of these later on. So how does a plant make vitamin B6? Well, it needs three things: nitrogen, carbon dioxide, and water. And then it mixes them all up and produces a ring, which is what they call an aromatic ring, not because that it smells nice, it's just the shape of it. And then that's vitamin B6. So that's what we get in our diet. The gut bacteria also make B6, and there's a few of these: the Bacteroides species, the Bifidum longum species, and then a few others and Collinsella, which is an important one for activating the bile salts. And then there's a couple that probably you don't want too many of, like Prevotella and Helicobacter. Yes, the famous stomach ulcer bacterium. So you have three different sources of B6 that go into the gut, get absorbed, and then go up to the liver for processing. Now, B vitamins in general have a similar process. We get the vitamins from the nutrient flow, and then we activate them to something. And that activation usually requires minerals. So, for instance, B6, the mineral that it needs is zinc. And it also needs another B vitamin, oddly enough, and that's vitamin B2. And then you get the activated nutrient. And then that activated nutrient, which is in the cell, creates the cell output. So it might be helping the bone marrow cells make red cells, for instance. So all the B vitamins mostly have this function, that they are transported in the blood in a non-activated form, and they are taken across cell membranes and then activated within the cell. That's a fairly common and standard process. Now, sometimes you read on blood tests that transcobalamin, for instance, is the active form of vitamin B12. That's actually quite misleading to anyone reading it, because the active forms of vitamin B12 are cyanocobalamin, hydroxycobalamin, and S-adenosylcobalamin. And in fact, the most prevalent form of activated B12 in any cell is S-adenosylcobalamin. It is not transcobalamin. So when you read that, just take that with a grain of salt. So, coming back to vitamin B6. Vitamin B6 is a real enigma in some ways, because it's actually transported in its active form. And it's an unusual thing, because generally activated Bs don't have any function in the bloodstream. It only happens when they get into the cells. But the liver does something strange. It actually adds vitamin B6, which is pyridoxine, to a phosphate group via an enzyme called alkaline phosphatase. And it sends that combination of pyridoxal 5-phosphate into the bloodstream. So it's secreting into the bloodstream the active form of vitamin B6. Now, there are 6 isoenzymes of alkaline phosphatase. And what an isoenzyme is the same tool, but it can do multiple jobs, or different tools that can do the same job. So we have an alkaline phosphatase in the gut called intestinal alkaline phosphatase. There's one in the placenta. There's one in the bone, one in the liver, one in the kidney, and another one in the plasma itself, usually attaching itself to the outside of the cells. So the reason that we have so many of these is that they have different functions depending on where they're situated. Some of it may be to deal with B6, some of it might actually be to deal with a phosphate. One of the unusual symptoms of a high B6 is a low phosphate, and you'll see why in a minute. So the pyridoxal comes along. It's been processed by the liver to combine it to phosphate. It goes out into the bloodstream. But when it gets to the cell wall, something different happens. In the general population, the alkaline phosphatase in that site, it actually splits the pyridoxal and the phosphate back into the original forms. So what you get there is B6 and phosphate being converted. And the reason for that is it's quite hard to transport anything attached to a phosphate across a cell membrane. So the most efficient way to do it is to split them up into the B6 on its own, the phosphate on its own, and have special transport tubes just for those two things. And that's how the B6 and the phosphate get in the cell. So on the other side of the cell membrane, there's another alkaline phosphatase, and that joins them back together, and then you have the activated B inside the cell. So there's a lot more steps to this than there are, say, with vitamin B12, where the B12 gets taken across the cell membrane and then activated either with a methyl group to create methylcobalamin, or an adenosyl group to create adenosylcobalamin. So there's the problem, in that whatever drives these processes can be interfered with. And in fact, anything that looks similar to pyridoxal 5-phosphate and has a phosphate group can create havoc with a system like this. Now, normally, the only things that bind to phosphate in the bloodstream are calcium, magnesium, and sodium. We've got a few like phosphatidylcholine, which is a phosphate group, and a choline group. But in general, they're swamped by the trace elements, calcium, magnesium, and sodium. So anything else that floats around is going to confuse this process. And in general, what happens is as the B6 level goes up, so does the functionality of the B6 because there's no holdups in it. But what we're seeing is there are some people with very high levels of B6, but their symptoms match more like the B6 deficiency. So trying to figure out where that problem is, there's several options of why the B6 might be high. The first thing is way back in the liver, something is egging that enzyme in the liver to work harder. So if you can imagine a lever on an assembly line, instead of it being, 20, 30%, so that, there's just enough B6 and phosphate coming into the assembly line, and then there's just enough pyridoxal 5-phosphate being made at the end of it. Somebody has got that lever on that enzyme and ranked it, pulled it to full on. And that's called inducement. You can induce an enzyme to work harder. It's not a new thing. There's heaps of examples of this. And the liver, because it's got so many enzymes, is probably the best studied for liver induction or enzyme induction. Well, it turns out there's one compound that we'll be exposed to that does exactly this. It induces higher levels of alkaline phosphatase in the liver, and that compound is the herbicide glyphosate. Now, you can go away and look that up. I'm not using the trade name for it. I'm using it as a generic. But there's studies to show that the liver damage from this compound is directly due to its effect on alkaline phosphatase. The trouble is that with toxicology, you tend to get a study just on the bad points of something, and you don't necessarily see the downstream effect on nutrients. But if you can combine the two, you can see that if glyphosate increases the output of the liver's alkaline phosphatase, it will actively increase the level of the vitamin B6, the pyridoxal 5-phosphate, in the bloodstream. And the first time I found this out, I had a patient. Actually, I had my own level of B6 measured. It was outrageously high. It was 1100. The upper limit's at 190, and I wasn't taking any supplements. Not a thing. And I have another patient who had a level higher than me. His level was almost 3,000, and he wasn't taking any supplements, certainly none that had vitamin B6 in them. And all of the patients I've found so far, the only explanation for the high B6 is actually that they have glyphosate in their systems. Now, if you look at some of the things that have been written about B6 toxicity, I'll read you something from the USA National Library of Medicine. Pyridoxine toxicity or B6 toxicity usually manifests as neurological symptoms, including paresthesias in the extremities, in other words, numb pins and needles in the hands and feet. And in severe cases, difficulty walking. This sensory neuropathy usually develops at doses of pyridoxine above 1,000 milligrams a day. Now, I'm telling you, if you were really taking that amount, you would not feel very well at all. There are some case reports of sensory neuropathies at doses of less than 500 milligrams per day in patients taking supplements for months. However, none of these studies showed sensory nerve damage at a daily intake lower than 200 milligrams of pyridoxine per day. So my take on that is it isn't necessarily the dose that someone is taking, it's what the body does with it afterwards. That's the problem. So have a read about what the FDA and the TGA are saying about vitamin B6 supplements. What has happened in the same period of time, unfortunately, is vitamin B6 has been added to almost everything, almost like salt and pepper as a condiment to these supplements. But it still does not explain why the levels are so high. There's a third party involved in this. So, continuing on, B vitamins get transported across cell membranes. We've talked about there's a special transporter for B6. And it actually turns out that this solute carrier, these are the SLC carriers. B6 can also use thiamin's um, portal as well. So there's a lot of backup to stop B6 from um, getting into the bloodstream at levels so high. But technically, if you had a blockage of any one of those, you would see a high level of B vitamin in the bloodstream. Again, the blood is just the courier transporting these things around. The biochemistry of the body occurs in the cell. And this is one of the reasons sometimes we see high levels of B12, because it's the largest thing you have to transport across the cell membrane. If you can imagine a doorway, zinc is like rolling a marble across that threshold from one room to another. But B12 is like an adult in a wheelchair. You have to get it exactly perpendicular to the door frame and go relatively slowly. So it's a huge problem. And that's one of the reasons we see high levels of B12. We'll come to more of that. It isn't due to things like cancer or liver disease. There's a thing called a channelopathy. So the next crucial choke point is once the B vitamin gets across the cell membrane and it's inside the cell, the enzyme that then converts it to its active form might be blocked by something. And the fourth type of what we call functional deficiency is the B vitamin gets across the cell, it gets activated, and then it's oxidized by something toxic in the actual cell itself. So the total level of something in the blood is a bit like pouring water into a colander with lots of holes. If you pour faster, you're going to fill up the colander. If you slow down, the colander will, the level will drop. If you use 2 jugs to pour into the colander, then you're going to see the colander really fill up. And basically, this is what happens with compounds like glyphosate. The colander is full because there's more coming into it. There is another possibility that might explain the connection between glyphosate and B6, and that is the structures have a similar look to them. They could be confused perhaps by mass spectrometry or HPLC machines. And so what's being measured as high B6 isn't actually B6 as in pyridoxal 5-phosphate, it's actually glyphosate. So I'll let the labs sort that out. I'm going to attach here a paper from a journal called Toxics, and you can have a read. Association of urinary glyphosate with all-cause mortality and cardiovascular mortality among adults. Role of alkaline phosphatase. So the buildup of P5P is not due to the dose of P5P, unless it's up in the hundreds of milligrams a day or thousands of milligrams a day. There's something else interfering with the normal function and routine of that particular compound. So in patients that have high levels who don't have an intake, how do you explain that? And this is where the people talking about this should be looking at a control group to see whether the comparison. I mean, we do control groups because it's good science, isn't it? When we test the drug, we don't just do it on one group of people. We use a placebo so that we can have a control group. And yet none of these people who are complaining about the B6 have any of that information to show us. So this is why I think they need to have a rethink about what they're actually saying. And this is the reason why this can happen. If you look at the structure of pyridoxal 5-phosphate, it's basically a B6 with a phosphate hanging on the side. If you look at the structure of glyphosate, it's basically the amino acid glycine with a phosphate on the side. And unfortunately, there's several groups of the population who cannot break this down to inert compounds. And so the glyphosate just gets recycled. The liver tries to get rid of it, and then it comes back, returns to the bloodstream for another round. And this happens for years and decades. You can see the similarity of these two things. And this is why we need to have more information before making decisions about what's happening to vitamins.